right, which of the following is most likely diagnosis for this patient? All right, looks like a neuro. Excuse me. 58-year-old woman is brought to the clinic by her husband, who reports that she has been experiencing personality changes, including inappropriate social behavior and increased irritability. Over the last year, memory and orientation are intact. Difficulty with word finding and comprehension. Okay, past medical history is unremarkable. Brain MRI reveals atrophy of the frontal and anterior temporal lobes, which along is most likely diagnosis. I was initially thinking with the personality changes, inappropriate social behavior, frontal temporal dementia. Um, However, let's just double check this. Alzheimer's, I don't really think so. It's not usually how they describe it in questions. Vascular dementia, there's no like past medical history that would really indicate that. Lewy body dementia, um, possible with like little possibility, but I don't think so because it's not mentioning like Parkinson's like symptoms and dementia, and then NPH, wet, wacky, wobbly. That doesn't really seem like it to me. So I would just go frontal temporal. Frontotemporal makes the most sense.
Yeah, great. You worked through everything. So let's talk a little about it, right? So, they give you the MRI too, which is super important. So the frontal and anterior temporal lobes, which is frontal temporal dementia,
Yep.
right? And then also, usually mood changes, they have lack of inhibition, right?
Yes.
Of sexual urges, things like that. So
Yep.
they lose their personality a lot of times. So let's talk about the rest though. Alzheimer's, that's usually longer, right? Older, I mean,
Yep.
sorry. Older over a
Older, and then
prolonged
also
period
like
of time.
a not as a rapid of a decline, right? Like,
Exactly, exactly.
okay.
And then vascular dementia, I just want you to remember that this is kind of like mini strokes, if that makes sense, right? So
Yeah, we had a
lacking,
whole mini thing. Yeah, we had a whole talk on that the other day.
yeah,
Okay.
yeah. So mini strokes, right? So anytime you get a small stroke, you lose a cognitive function, right? So most people
Oh,
say like
okay.
on a certain date, like for instance, giving you an example, right? Like, oh yeah, 2 years ago wasn't able to remember my name, and then a year ago couldn't remember the house, or 5 months ago can't drive a car, right? So every time they have these
Okay.
small little infarcts, they lose some ability. So you should be able to track, right? You get what I'm saying? It's
Okay.
that's why they call it stepwise. You know what I mean? Stepwise dementia.
Oh, okay.
Yeah. And then Lewy body, exactly like you said, right? It's just Parkinson's with visual hallucinations, right? That's usually
Okay.
what
With
it is.
visual. Okay.
Yep. Normal
Okay.
pressure hypertrophy, like you said, right?
Wet, wacky, wobbly.
Yep. So it doesn't have any of that, right? So good. You went through the dementias really, really well, and they do love testing dementias on internal med for sure.
Okay. Yeah, I've seen a few of those.